Hello, Dr. Bushore here, Balcones Dermatology Aesthetics. We're going to talk about melasma today. As you know, melasma can be a very difficult thing to treat. And we'll show a before and after example of a patient that came to see me. She's in her late 30s. She said she'd already kind of done everything that was what we usually use to treat melasma. She'd done prescription strength hydroquinone, some salicylic acid chemical peels. She's had this for many years, and I said, well, we have some new things that we can do that can help treat melasma I've learned about in the last year, and so we're going to try these different things. I have a picture right here that we can take a look at. Her melasma, it's hard to see as much in this picture, but you can see with the VISIA picture where it shows up a lot across her forehead and above the eyebrows, across the cheeks and the nose, and even a little bit down here on the chin as well. So this was bothering her a lot. She'd already done some things that are kind of considered gold standard treatments for melasma. What I wanted to make sure of first, as I've talked about before, melasma for the longest time was thought to be due to two things. One is sun exposure and the other one's hormones. So birth control pills, pregnancy, it's considered even the mask of pregnancy. The third thing that we've found to be playing a role also is heat. And so heat can be one of two things, either the heat that's on the skin from the outside, but also from the inside. So inside heat would be that you have a lot of dilated blood vessels underneath the skin that when you get hot, your body dilates those blood vessels to release heat to the environment, and by doing that, the temperature of the top of the skin gets hotter and actually probably creates more melasma as well and kind of keeps it going. So I want to make sure with the VISIA that we didn't have too much underlying redness for her. And I can switch to this picture and you can see that with her brown areas, she doesn't have a whole lot of redness. She does have some that does match up a little bit with her brown areas, but when on the red picture of the VISIA, it turns really, really dark red. So we weren't doing so bad there in terms of redness, so I thought we can just treat the brown. So when we just treat the brown, we did three new things that she had never done before. And things that I've just learned about in the past year. One is a medication, it's a pill you take by mouth, it's called tranexamic acid. This is something that has been shown to actually decrease melanocytes from making their pigment. It's originally prescribed for people that have a lot of heavy bleeding, so for women that have a lot of heavy bleeding with their menstrual cycles, prescribed up to 3,000 milligrams a day, but just for a few days while they're having their menstrual cycle. When we treat for the melasma, we only have to take like a half pill twice a day. It's 325 milligrams twice a day. So really low dose. I don't like to keep people on it longer than when you need to. The people I don't prescribe for people that have any concerns about blood clots or things like that. The other thing that we did that was new, instead of doing, most prescription hydroquinone start at 4%, we went up to 12% hydroquinone with a 6% kojic acid and a vitamin C base. Use that twice a day, not even a retin-A, because a lot of people have irritation with that. And then the third different thing that we did was we did a perfect Dermapeel. This is a chemical peel that helps lighten skin color. It has a special ingredient called glutathione that helps calm inflammation. It's been used in India. This is going to sound odd. People are doing IV glutathione just to lighten their skin color in their whole body. Don't consider that necessarily safe because high doses of IV glutathione can cause problems with your kidneys, so don't recommend doing that. But topically it works well as part of this chemical peel that combines trichloroacetic acid like TCA peels. It has some phenol, it has some salicylic acid, it has lots of different ingredients in there that we don't know all the specifics of it, but it's called the perfect Dermapeel and can work great. So I'll show you, this is, so we did the pills, we did the cream, and we did one perfect Dermapeel, and this is before and after 2 months. So you can see that her brown areas above her brows and her forehead, and the brown areas across her cheeks and her nose, and even down in her chin area did lighten up. This shows up even better when you look at our before and after at 2 months with the VISIA, and you can see how much this did lighten up with all these treatments. Here we can see even better from the side. You can see her forehead, how much this brown did lighten up, as well as in the cheeks, the nose, and even in the chin. This is the right side, and then we've got the left side. Again, a big improvement with all these treatments. This I would consider a home run. She was ecstatic. When we get to this point, we can start backing off, of course, the pills first and start backing off the cream as much as we need to. But an amazing result. I don't know if I can always guarantee this, but we now have better treatments for melasma. These 3 things that most people have not tried. So if you're interested in getting your melasma treated, come see us at Balcones Dermatology and Aesthetics.